We are a 240-bed licensed hospital. We have this beautiful cancer center. We provide cardiology services, orthopedic services, family practice, primary care, and really we serve a 6-county region, all the counties surrounding Phelps County, and many outlying clinics that serve those communities as well.
We're here at Phelps Health in Rolla, Missouri. Matt Smith here, Matt Smith Real Estate Group, doing another community spotlight, showcasing amazing businesses in our community. Today, I'm here with Jason and Paige from Phelps Health. Thanks for being here.
Thanks for having us.
Excited to be here.
Yeah, this is a beautiful facility you guys have here. We were talking a little bit offline about all the amazing things that you guys have to offer. I can't wait for the viewers and listeners to hear all that you have. So let's get started and just kind of an overview of Phelps Health has so many things to offer. Can you kind of give us a brief overview of all the amazing things that you guys do to serve our community?
Sure. Well, we are a 240-bed licensed hospital. We have this beautiful cancer center. We provide cardiology services, orthopedic services, family practice, primary care, and really we serve a 6-county region, all the counties surrounding Phelps County, and many outlying clinics that serve those communities as well.
Okay, so we were talking a bit offline, and Phelps Health got started with a pretty unique story. I would love for you to share a little bit about how did Phelps Health get started?
Yeah, absolutely. So Phelps Health is a nonprofit county-owned hospital, which is kind of unique. And I think what's even more unique about Rolla and this region, and specifically Phelps Health, is that we were funded by philanthropy. That's how we got our start. So the original land that the original PCRMC, or whatever it was called before that, was actually donated to the hospital.
Oh, wow.
And so we've been able to take that from inception to now we have this whole suite of services like Jason's mentioned. And not only that, we also have a foundation that aligns strategically with the different needs that are happening at Phelps Health so that we can continue that outreach to different communities that we serve.
I love that. I love that. It's very community focused, and just how can we serve? I love that word. We use that in our business too. It's a business, of course, but we're here to serve the community. I love that we have that in common.
Mm-hmm. Yeah, absolutely. Well, with our recent Heart to Heart event, I thought it was a really cool collaboration with Matt Smith Real Estate too, because you guys provided a sponsorship for us, which is amazing. But the best part to that is whenever we're doing anything as an organization, and Jason can probably speak to this too, but one of the things that I think is so important and that we do really well is we want to align strategically with organizations, individuals in our community that really want to see us be successful, because when we're successful, our community is successful. So whenever I think about cardiology and Heart to Heart and raising funds for specific equipment that directly impact patient needs, I go back to this is the heart of what we do. We are here for our patients. If it weren't for our patients, we wouldn't be here. This organization wouldn't exist.
Yeah, I love that. So that's a lot of giving back to the community, serving the community. As we talk about that and stay on that theme, is there something you can think about, maybe an initiative that really stands out that you guys have really given back to the community with?
I think one of the things is creating this cancer center, the Delbert Day Cancer Institute. And that was really a community focused event or effort, and to create comprehensive cancer care right in the community. So from medical oncology, infusion treatments, radiation oncology, all that can really be done here. And actually, when I arrived here a little over 8 years ago, that was really my first project, was finish getting this building built, working with Dr. Chris Spencer, and getting up and running. And so I think just the success of this, not only the facility, but just the programs that we provide, the cancer care and treatment that we could provide locally so that people don't have to travel. I think it's just a great way of how we give back and try to make care local, convenient, and really high quality. One
of the things too, Matt, that I think is really cool that I'll just continue to reiterate from a foundation perspective with this is this was a $43 million project, which is huge. $7 million of that was raised with the help of Delbert Day, his family, and also over 1,000 different businesses and individuals in our community, which is huge. It's really this idea of we do so much as an organization because our community feeds into us so much. We couldn't do it without that type of support. The DDCI wouldn't have existed.
What are some of the community outreach programs you guys offer?
I think some that I'll talk about from my standpoint is one of the newer things that we're doing is our Transformational Rural Community Health, which was funding that we got from the state, but we really brought together several stakeholders in the community. There's so many, I'll probably miss some, but Four Rivers, the local FQHC, Compass Health. I know I'm missing several others, and really formed a board to really decide what are the needs in the community, how do we use these funds to go out and impact some of our most vulnerable patients in the community. And it's newer for us. We're just getting into this, but it really is going to have a big impact over time because there's a lot of people that don't have the means to even get to a doctor or even basic food needs or housing needs. And so we actually have funding that we can use and give to those individuals and make sure that they're getting the things that they need to be healthy, to take care of their needs that they may not otherwise be able to.
Love that.
So that's one of the things that comes to mind for me.
Yeah. What about you?
Yeah, so, I'm kind of laughing because I know before we pressed play on this, we were talking about how maybe Phelps Health is the lifeblood of the community. But in some ways we really kind of are, and I laugh whenever I say that, but it really is true because I think about all of these different partnerships like the Torch program that Jason's talking about, but just on a day-to-day basis, different types of programs we have. We partner with the center through their MyFitRx program. So if you have somebody that's going through maybe a major stroke or an orthopedic surgery and they need to go through treatment. So maybe they need to go through like a physical exercise program. There's an 8-week program at the center that's offered. And so the foundation pays for half of that cost so that individual can go, they can get the treatment they need. And that's just one of many, many programs. One of the other ones I mentioned earlier, since we're in the DDCI, is called Define Your Shine. So we've partnered with Fit and Square so that individuals that are going through cancer treatment, that's one of the hardest things probably that an individual or a family could go through in their lifetime. Sure. So having these individuals come in, teaching them how to take care of their skin, how to wear makeup that's going to make them feel and look their best and not irritate their skin as they're going through treatments is really phenomenal. And those are the different types of things where we're constantly pulling in different community members, different organizations to make the biggest impact that we can, like Jason said, on some of our most vulnerable populations.
I love that. There's so much that you guys do to give back and connect with the community. I'm just really glad you guys are sharing this with me today. I'm learning a lot, and it just makes me feel really proud to live in this community. So as we're having this discussion, I'm thinking of our core focus as a company, and our core focus is changing lives. And we do that through people buying and selling real estate. It's not as impactful as what you guys do, but we feel we have a very positive impact in people's lives in the community. Everyone needs housing, and we're very blessed and fortunate to help them with the biggest purchase or sale of their lives. So as I mentioned, changing lives, what you guys were talking through just made me think about changing lives a lot. And I guess I'm just curious, if I said you guys change a lot of lives, what does that mean to you?
I think from my standpoint, we get a lot of letters. We get letters from patients that are either positive or negative. And, I think, you take in both and you learn what can you do differently or better. But I think when we do get the positive ones, it makes you really get back to the core of why we exist. And, we actually started a few months back. We always start one of our board meetings with reading a patient letter. We leave it anonymous. We call it our mission moment. And so it gets the board, and before we have that meeting, back to why are we even here? And so we always start off our board meetings now with reading one of those patient stories that we get, because it's amazing, when I get to read those, the difference that people are making in individuals' lives. And most of the time, our providers and caregivers don't even know that they're making the impact because they're just doing their job. Sure. But to that individual, it makes a huge difference.
Absolutely love that.
Yeah.
What about you?
So I'll kind of answer this question from a different perspective because I think Jason nailed it. That's exactly why I love the work that we do in the foundation. So I'll focus on our employees because one of my favorite parts of being over the foundation as the philanthropic arm of the hospital is being able to work with different employees to impact those patient needs. So we recently went through an employee giving campaign and we raised twice as much money as we did last year. And the only reason that we were ever even able to do that, Matt, is because we had employees sharing those stories of how impactful these funds were from different community members, from different employees, whether it was buying another employee clothes so that they could go to work because they were just they were down on their luck and they hit hard times, or whether it was buying a piece of $5,000 equipment so that a patient didn't have to be on a feeding tube the rest of their life. Making a difference or changing lives can look and feel different every single day. And I get really emotional about it, right? Yeah. But those are the types of things where I wish everybody could do a walk a mile in my shoes, because the stories that I get to hear on a daily basis about the impact that our employees have on our patients' lives, like that is Phelps Health to me.
I love that. I absolutely love that. And that's kudos to you as the leader of an organization for sharing that and distributing that through everyone. It just, that's really cool to see and hear. the experience that creates for everyone. So you mentioned nonprofit and you mentioned the foundation. For the viewers that maybe don't understand what the foundation is, could you kind of break that down for them?
Yeah, absolutely. So whenever I tell people I'm the director of the foundation, they say, what is a foundation? What does philanthropy mean, right? It essentially means giving back to your community. So we take in the funds, we distribute the funds. So the Phelps Health Foundation functions as the philanthropic arm of Phelps Health, which again is a lot of words. Essentially, we are the gap filler. So whenever we talk about different organization needs, whether it's a direct patient need, like paying for a medical bill, pieces of equipment, maybe we pay for their rent because they're going through cancer treatments, which are, undoubtedly very, very expensive, and those costs become really a burden for them. So we can walk alongside patients in that way. But the other part to this is we also support different department needs that are that impact patient care. So, for example, with the DDCI, we had a capital campaign for that because we have lots of equipment that are needed. But whenever we talk about capital budget and operational budget, and Jason, correct me if I say any of this wrong, there's only so much money to go around.
Sure.
So we've got dozens of different service lines because essentially the hospital functions like any large metropolitan hospital would. We have all the same suite of services. But the problem is that there's only so much money that you can give out every year. So it's kind of like pieces of a pie. So if everybody gets the same amount of the piece of the pie, well, there's no pie left, right? So we run out of that money. And so that's really where the foundation can come in, and we can support those different initiatives to buy necessary equipment to impact patient care, whether it's a mammography machine or a Trinit machine that helps look at breast biopsies. So there are a lot of different ways that the foundation can really kind of align strategically with what the organization's doing to support those different needs that we have, whether it's direct patient care or it's equipment that directly impacts patients.
Wow, the foundation sounds incredible. For somebody that's listening and maybe inspired and wants to get involved and help out and do their part, what are some ways that they can get connected to the foundation and help out?
Yeah, that's a great question. So you can go online to our website, phelpshealth.org. There's a little giving tab right at the top, super easy to get to. You can go on there and learn more about the foundation. We have a 2023 report that you can look at. We also have quarterly reports that kind of show you where your money is going, because whenever we talk about philanthropy, we want to be as transparent as possible so that people know where their money is going and exactly who it impacts. So I think that's the most first part really to this is educate yourself on what the foundation does and really what it means to be philanthropic. I think the second part to that is regardless of how much money you think you have or how much time you think you have, we love any type of resource that you have available. So we like to call it a doer, a donor, or a door opener. So if you're somebody that wants to roll up your sleeves and help us run a golf tournament, we would love to have you help run carts. If you're somebody that wants to sponsor a golf tournament that's impacting our EMS space, for example, that we're raising funds for, that's fantastic too. Or maybe, Matt, you have a couple of connections in Waynesville, since we're really kind of breaking out into that area too, where you can help connect us and say, hey, we all really have a shared vision for this community. Let's walk alongside each other, because when one of us is successful as an organization, I really think all of us are successful.
I love that. We can all win together.
Yes.
Absolutely. That's what small community and small towns are all about. So what are some of Phelps Health goals and future aspirations?
I think on the immediate horizon, one of the things we're working on right now is our emergency medical services base, our EMS base. And so it's actually being built, should be done early in 2025. But it's really just the beginning of our emergency services planning. We're currently planning a new emergency department and really looking at trying to determine the plan, funding by the end of this year. And then later in 2025, really look at getting that project up and going. But it's just a vital service. Emergency services in any community is important. And as we've seen our community grow, the needs of emergency services change. We're really trying to adapt and be ready for what the community needs as we go into the future.
I love that. Yeah. That's very, very important. So I love that you guys are putting a focus on that. Paige, what about you? Anything you want to share?
So the only thing that I would share is that the whole function of the foundation, I know I've mentioned this a couple of times, is to support those strategic initiatives that are really set by Phelps Health. So that's one of the big things that we're working on as well. Our golf tournament this year was really focused on the EMS space, helipad. So I anticipate that we'll have a lot more funds to raise in the coming years, but we're really excited about it.
Well, guys, thank you so much for taking the time to do this. Phelps Health is such an important staple in our community. I love the work that you guys are doing, the mindset that you have of bringing communities together, of changing lives in a much more impactful way than we're able to. But I love that we have that in common. Thank you so much for taking the time. I really, really appreciate it.
Thank you as well.
Thanks. This is great.
Yeah, this has been amazing. And guys, if you want to get involved, you want to learn more about this, you want to learn more about how to be part of the foundation and give back, it was phelpshealth.org.
Yep.
Phelpshealth.org. You can can learn some more information there and be a part of these amazing people that are doing amazing things for the community. Thanks so much for watching.